All right, so this one's a little different. Welcome back to Podiatry Unfiltered. Usually it's just me on here and I share what's on my mind about podiatry, business, and everything in between. But today I have Tim with me. And honestly, this is just a conversation we've had 100 times, but without a microphone on. I invited Tim onto the podcast. He was an easy guest to get since he lives in my house. And he's just really good at having the conversations with patients. So I wanted to pick his brain a little bit about how he goes about that conversation. And it just turns out he's just real with the patient. And I think that's important. So I wanted to pull back the curtain a bit, talking about how we present treatment, how we build trust, and how we help patients move forward for the right reasons. And before I start this episode, I did want to say our practice model has changed over the years. We used to be high volume, and it was not uncommon to see anywhere from 8 to 12 people each in an hour. That lifestyle was not sustainable for us. I'm going to start this episode with Tim Henne. This is Podiatry Unfiltered, and I hope you enjoy this episode. So a woman walks into her office, 52 years old, teacher. She's had plantar fasciitis for 14 months. She's seen 2 other podiatrists. She's had the injections. She's done the stretches. She bought all the things. And she says to me, I'm not here to waste your time. Just tell me if I need surgery or if I have to live with this.
Classic setup. She's already been failed by 2 doctors.
And here's the thing. If I had done what most other podiatrists do, I would have said we could try some Shockwave or maybe laser. There's also regenerative options. It depends.
And she would have walked right out and Googled foot surgery near me, and you'd never see her again.
Exactly. Instead, I looked at her and I said, you don't need surgery. You need a real treatment plan. I'm going to recommend something specific, and I'm going to tell you why. She booked that day, and 6 weeks later, she was back in her classroom, pain-free, for the first time in over a year.
And that is what this episode is about.
Welcome back to Podiatry Unfiltered. I'm Michele McGowan, podiatrist in Claremont, Florida. And today I'm joined by my favorite guest.
Favorite key before husband, I noticed.
Oh yeah, and my husband and business partner and fellow podiatrist, Dr. Tim Henne. Today we're tackling the thing most podiatrists are terrible at and nobody wants to admit.
Selling. And I believe we agreed the introduction was Tim Henne, special guest and esteemed podiatrist.
Tim Henne, my husband. But we're not talking about the sleazy kind of selling. It's the kind that actually helps patients. Here's what I see constantly. Pretty smart doctors, pretty good diagnosticians, but they're just afraid to talk about the things that they can offer patients that aren't surgery that could help them get better. And then the patient asks about treatment and they sound like they're apologizing for existing.
There's this thing called Shockwave, and some people find it helpful. It's not covered by insurance though.
So yeah, stop. Just stop.
And then the doctor wonders why the patient says, I'll think about it, and never come back.
So patients don't just buy treatment, they buy confidence. They're looking at you for leadership. And if you don't give it to them, they'll find a doctor who will, or worse, they'll do nothing and keep suffering.
Which is the part that gets lost. When a podiatrist fails to present a recommendation with conviction, they think they're being humble. What they're actually doing is leaving that patient in pain.
So let's define this, because the word selling makes podiatrists break out in hives.
Ethical selling is 5 steps. You listen, you diagnose, you explain the options. You recommend, genuinely believe the best. You then let the patient decide. That is it. That's the whole thing.
It's not manipulation. It's not pressure. It's helping someone move forward when fear, confusion, money, or procrastination are just getting in the way of their treatment, of their own health and their own healing.
And here's the uncomfortable truth. If you don't help them move forward, you're not being ethical. You're being avoidant.
I totally agree with that. So before we get to presenting treatment, we have to talk about the thing most podiatrists skip entirely.
Discovery.
You cannot present value if you don't know what the patient values. And most of us, be honest, we barely ask. You have to ask. We ask, how long has it hurt? on a scale of 1 to 10. And then we go straight to the exam.
But the real question is, why can't you do right now what you want to do?
That one question changes everything, because when the teacher tells me she can't stand through a whole class without her foot screaming at her, I'm not selling Shockwave. I'm selling her classroom back.
When the grandfather tells me he stopped walking the dog because it's not worth the pain afterwards, I'm not selling laser. I'm selling his mornings back.
That's the reframe. Treatments are abstract. Life is concrete. Find out what life they're missing, and then your recommendation becomes the bridge. Okay, so let's get tactical. Chronic plantar fasciitis patient, failed the basics. How do you present Softwave or a class 4 laser?
I'd say something like, Miss Patterson, you've been dealing with this for over a year. We can keep chasing the symptoms, or we can use a treatment that's actually designed to stimulate healing at the tissue level. Based on what you're telling me about wanting to get back to teaching without pain, I'm recommending a course of Softwave. This is what I would do if it were my own foot.
Notice what he did there. He didn't sell technology. He sold her classroom back, and he added the trust multiplier. This is what I would do if it were my own foot.
Because that should be true. If you're recommending something you wouldn't use on yourself or on your spouse, you've got a bigger problem than a sales script.
Okay, now the big one. The patient says, I'll think about it.
Which almost always means one of three things. 1, they don't understand. 2, they can't afford it. Or 3, you didn't give them enough conviction.
And most podiatrists respond by saying, okay, no problem. Just call us when you're ready, and handing them a brochure.
Which is the conversational equivalent of giving up.
Here's what I say instead. Totally understand. Can I ask, what specifically do you want to think about? Sometimes it's the cost. Sometimes it's the commitment. Sometimes it's just wanting to talk to your spouse. Whichever it is, I'd rather answer it now than have you leave with unanswered questions. It opens the door instead of closing it. 9 times out of 10, they'll tell you the real objection, and then you can actually address it. It doesn't mean you're actually going to sell it each time. It doesn't mean, and again, when I say sell, it doesn't mean I'm trying to force something on a patient they don't need. I'm trying to give them an option they didn't know existed. I think that's important. You want the patient's questions to be answered so that they're even more informed. They don't have to do it the first time you see them. And I say this all the time, the regenerative stuff does live in the space between conservative and surgical. So it's here. This is a really good spot. Instead of spending $6,000 on their deductible to have surgery, anesthesia, and all this stuff, try something in the middle that's going to be much less than that. And that's also another way to pose it, don't you think?
100%.
The other thing I want to talk about is money. The patient says, that's expensive.
Here's my go-to. I understand. The real question is whether continuing to deal with your pain is costing you more in the activities you've given up, the workouts you're not doing, the jobs that you're going to miss with surgery, the time you have to take off to recover. Let them think. Give them a minute. But I typically see 2 types of patients in my life. There's patients like my wife. My wife shows up at the doctor. She probably knows more than the doctor. She's going to do everything she wants to do. She's literally showing up to see if that guy or woman is a total moron and knows what they're talking about. And whatever they say, she's going to do whatever she wants to do. She's going to pay for it and let me. This is what we're doing. And that's patient number 1. Patient number 2, then there's me. I show up. I get all the information. I take it all in. I take whatever paperwork that doctor gives to me. I go home. And if she thinks I'm worth whatever it is, I go back and get it done. We're not in a hurry. You don't need to do it today. Actually, print it off. And patients go, I need to talk to me. Fine. If you want, you can go home and do it. Take a picture. Text whoever you want. I'm going to go see a couple other patients. If you don't want to do it, feel free. Go away. Come back. Whatever you decide, I still like you. If you want to do Softwave today, we can, whatever you want to do, there's no pressure either way.
I will say that in our office, Tim is really good at first visit converting somebody who's come in, they've had plantar fasciitis, insertional Achilles tendonitis, any of the itises, they've come in and they're miserable and they've tried everything. He can convert on the same day. He should do a master class on how to sell these services. And again, selling is not a negative thing. But yeah, you want to give them all their options that same day. I tend to convert on the second visit. He tends to convert on the very first visit. But when you have this technology and you have things like Softwave, you have things like the laser, it's just not a lot of other podiatrists, not a lot of doctors are providing these services. and patients are looking it up. You have to pair these things together with the patient, but it has to be the patient's best interest in mind.
And I tell patients, it's not like surgery. It's not cold. It's not anesthetic. It doesn't smell like alcohol. You're not going to go to bed, wake up and out of it. The whole time I'm there with you, I'm here for you. I actually give them my cell phone number, but you can text me.
And we talk about all of this. It's not manipulation. That's removing the barrier from the care that they wanted. Let's just do a speed round of mistakes. Yeah.
We could maybe try this as an option. Some people like it.
Compared to, I'm recommending this for you, and here's why.
Talking too much. The more you talk after making the recommendation, the more you look like you're trying to convince yourself. Not them, yourself.
Leading with a price. Never. Lead with value, and then mention price, and then stop.
So all my patients that I do this on, typically the most common people I would say are plantar fasciitis and Achilles tendon. By far my happiest patients, plantar fasciitis and Achilles tendon. No. You need 3 things to get it better. You need home physical therapy every night. I'm going to teach you what to do. You need to support or protect your foot during the day with whatever you need, a cam walker, orthotics, and you need to learn to adjust your life a little bit. The issue with typical plantar fasciitis, you do physical therapy every night, you do stretching and icing, it's going to take 2 to 3 months to go away, even if you adjust your life. So I say, it takes 2 to 3 months. We have more expensive, fancier ways to do things. So if you're in a hurry, you have some extra money, we can do this stuff. Let's go through everything. Okay. I'm going to print off everything. I give all my patients the same advice. I don't know where we are in this relationship. I met you 5 minutes ago. I don't know if this is the beginning of our relationship because you're going to be better in 2 weeks. I don't know if this is the end of our relationship because you hate me. I don't know if we're going to be playing this for 2 to 3 months. Either way, I'm here for you. But since I don't know where we are in this relationship we have, I'm going to print off everything. But before we talk about any prices of all that stuff to get you back to normal quicker, I'm going to teach you what we typically do for everybody.
Right. And I agree with that. And so again, on that spectrum, this being most conservative to this being surgery, I always offer the most, if they come into my office
every time
and they say, I have plantar fascia, and you have to be a good doctor. You have to be a good podiatrist. So if they come in and this is the first time they've had plantar fasciitis, I personally, unless they come in and they say, I have a race in 2 weeks, we see a lot of younger kids who run track and cross country. We see soccer players. We see all of the athletes. That's a different category. If they have something, if you have Michele McGowan walking in your office who walks 4 miles 5 days a week, and I come in, you're like, oh yeah, we're going to put you on a Medrol dose pack. Here's some icing. Here's some inserts. If you have not tried any of that, would you agree?
100%.
You're not. Let me shockwave the shit out of you. That's not what you're doing.
100%.
But if you have, I'll use my daughter. If you have a Lily Henne who's got a race in 4 weeks and she wants to run a half marathon, and even though she's not competitively running, she's always competitively running, and she wants to win that race, she'll come in and say, yeah, I need to be better sooner because I can't wait 4 weeks to be better. I have to be better in the next week and a half because I need to train, because you can't run that race. A Michele McGowan and a Lily Henne are 2 different beasts. And then on the flip side, what I'm saying is you need to offer the most conservative option.
I don't say you need, you have to.
You have to.
Otherwise you sound like you're selling, and you're not selling.
All of a sudden, you can't be just walking in the room with the Shockwave, like snap, snap. So yeah, we do. We offer the most conservative care first that their insurance will cover. But the reason that I think Tim is able to convert a little quicker, because he will see that patient that comes in who is that track athlete, who they have a race on Saturday and it's Monday. So he'll Softwave them Monday, Wednesday, Friday before the race, he'll laser them. And they come in on Monday and they say, oh my God, I PR'd, but I want to do that for the next 3 weeks until my season ends. There's a real advantage if you can market this correctly.
It's not just a backup for surgery. It's a way to get better, back to normal, is quick. You don't realize how many, as doctors, every doctor here understands time is money. Let me let you in a secret. Patients' time is money as well. And a lot of them, their time is more valuable than yours. Assuming the patient can afford it, you are not their account.
One of the most expensive mistakes in podiatry is a doctor who presents beautifully in a front desk that fumbles the handoff.
You've done the hard part. The patient is in, and then they walk to the front desk and someone says, I need to check on the price for that. Maybe, I really don't know. And then the whole thing collapses.
Your team needs to be trained. And this is an unpopular POV. In our office, and I see, like, we're on all of the groups.
All those little social groups. Totally.
All the groups. And I love them all. If you're seeing this and we are members of your group, don't kick us out because we love you. So what I'm saying is, in all the groups, what I do see in some of the conferences I've gone to, and I respect a lot of these people, in our practice, what seems to work is our genuine approach to speaking with the patient. So again, when a patient comes in, I give them the spectrum. My normal conversation, if you've never had this problem before, let's do a medral dose pack, icing, stretching, over-the-counter insert, and they do great, right? But if they don't do great, before we get to that point, I let them know, here's the spectrum. On that very first visit, I tell them, if you don't do well with this, the next thing is we could do a shot, which your insurance will cover, or we have all these fabulous regenerative medicine pieces, whether it is an allograft injection.
I literally talk about everything, every visit.
The first visit,
the second visit, the third visit,
and
every visit.
It's that exposure.
Totally.
Sometimes for patients is what they need. And they go home, they research, and this stuff may work for me, but I don't have. So like that part about your staff fumbling it. Yeah. If you leave it up to the person that may have worked for you for the last 20 years, and now you're doing DPMX or you're doing liposana, and you want them to explain the pricing, or you have an MA who, granted, they might be pretty bright. We have some pretty bright college students with us, but I don't let them talk the details with the patient because I know the details. One, I know what I paid for it. And I also know the value for the patient. So what I explain to the patient is, this is our charge. If you're interested in this, here's a pamphlet. This is the charge. And for Tim, 9 times out of 10, they're like, okay, I'll do it. For me, 4 times out of 10, they do it the first time. And then 8 times out of 10, they do it the second if they're not better, because they trust us. Because we're not.
Yeah, I totally get it. My wife doesn't trust me to set up the microphone for this podcast. I get it.
He broke one.
I didn't break it. She
broke it.
Because she knows there's a chance I'm going to screw it up. Yeah. You don't have to screw it up every time. You only have to screw it up once.
But I had a backup microphone, but at our office, we don't have a backup patient. So I think it is very important.
When in doubt, it's all about me. I don't let the staff do anything.
It's going to be
We're not in a rush.
We're not in a rush. We do a 45-minute visit for a new patient, which is awesome.
You sit that back.
Because you know
take
what?
Your time. It's worth it. Trust me.
It is
your time.
So worth it. So then we sit there, we talk to them, and they know, like this, they may ask, I saw you have this Softwave. And again, these are patients you should be doing the VAS.
Every time.
So this is one of the reasons, like, I love my Softwave because I think it gets people with chronic problems better, profoundly a lot better.
Permanently.
In a sustainable way. It heals. And then it's not that I don't think the class 4 laser doesn't work, because I think it does. But when they have, as they've gotten better from insertional Achilles tendonitis, and they have, now I'm starting walking 3 miles a day, and you didn't do that.
I ran a marathon yesterday, and now it hurts in my other foot.
Listen, dumbass, you didn't do that. You never did that before. Now you're starting to do it.
Exactly.
So
these are the best. This happens.
So what I do is I will say, hey, no, I will treat you like this is a new problem. And so if they have insurance, I bill their insurance, but I might do something because they've already invested so much in their care. So if they have insurance, I will bill their insurance, and then I will do a laser, because the laser's freaking awesome too.
And more importantly, the problem is new.
So the laser works really good.
So good for the news.
You have to be able to play with your devices. I have a lot of younger practitioners, not even younger practitioners. I have people who left their group. They're my age. They just started a practice. They're like, what should I do? And I'm like, do the laser. If you're going to start, laser's a good place to start.
If money's an issue, it's a great place to start.
Yeah, if you're just looking to get in the regenerative space, doing class 4 laser, I think, is a great start. If you want to get into the knee-deep musculoskeletal treating patients, the Softwave. But I'm just trying to offer the most state-of-the-art things for our patients. I actually saw recently in a different podiatry group where I think more of an office manager type person, I don't want to name the group, talked about how they really maximize every patient visit with their aids and all this stuff. Dude, I don't want to do that. And if you're entering the world of regenerative medicine, and if you really want to be impactful to your patients, I wouldn't outsourcing everything to your MA. That's just my personal, and not too much on trying to step on anybody's toes, but I don't want to see 15 people in an hour. I want to see 15 people in a day. So that's why we price point our Softwave at $1,577. So every time somebody comes in, even if it looks like on the schedule, Tim has 5 Softwave follow-ups, but they already paid $1,577, so it's not worth anything. That patient in that room at that time is still worth $260.
Yep.
And I think you have to respect that, because that patient who sees you, they're going to refer people. And I had that same thing happen today. I had a patient who I saw their daughter. She was a soccer player. I did the Softwave on her, and you saw her a couple of times. The mom went back and told her doctor, who happened to be a direct primary care doctor, about us, and she wants to send us patients. Like, that is what you want, because when you spend more time with the patient, you're actually investing in them, but you're also investing in yourself. Wouldn't you agree with that?
Yeah, they don't want to pay a lot of money to see your staff. Let me just say here.
And I don't know. We used to have, there was a time in our career.
Everybody's made this mistake.
I think we've all made this mistake. And then I think it keeps getting propagated through time. It's like, tale as old as time. But I think what happens is we hear that narrative. You have to see more. You have to do more. I think that there's that period where in your career, we each had, I want to say, we had two freaking. Yeah. I also felt like the MA slowed. I'm from up north. Tim's from Minnesota, which is north. But I feel like the MA slowed me down to the point where I was like, I got to get in that room. I don't want them to numb up the toe. I just want to get in there, do it myself, get it done, get out. But I digress. I think that if you want to use an MA, fine. Make sure you train them to the way that you would do it. And I'm not just saying, like, when I go in and I'm doing the second, third, fourth Softwave, I go over the VAS scale with them. I go over what we did last time. I think that's
then
important.
When the patient says, well, now it hurts over here, the is going, all right, I'll put it over there. You literally need to work up this problem and whatever else comes up on the way.
Yeah, I agree with that. I think we're in a space right now in podiatry where...
Medicine, not podiatry.
No, but I'm talking about...
Medicine's a disaster.
Medicine's a disaster, but I do think that in podiatry, patients
we can fix it.
I do feel like we can fix it in a lot of ways, but I think we are seeing a lot of these musculoskeletal problems in the foot and ankle.
AI is not fixing what we're doing.
Yeah, no, we're a good profession for this. Here's what I want every podiatrist listening here today to walk away with. If you truly believe that a treatment can help your patient, presenting it confidently isn't unethical. It's your freaking job.
And if you don't believe in it, don't offer it.
I
Take
agree.
it off your mind. Problem solved. You don't have to do it.
Yeah. I feel like the patients who need you the most are the ones who've already been failed by someone who mumbled through half-hearted recommendation. Be the doctor who actually leads. I think that's important.
So have you had this done to you, Michele McGowan, Lasers and Softwave?
I have.
Have you done it to me?
Yeah,
Have we done it to our kids?
No,
Do we do all this to our family?
I said...
Do I bring to tournaments and stuff for our kids? Yes.
So, like,
We're
here's
not selling. We're telling the truth. We use this on ourselves.
We do
Even
use this on ourselves.
everybody.
I had a patient who I was talking to her about the laser, and I was saying how Emma's addicted to the laser. Our youngest is 14. She plays soccer, and she could have the minorest thing now. And she's, oh, can you bring the laser home? Call dad. See if dad can bring the laser home. Oh, call mom. See if mom can bring the laser home. And she's a huge believer. We use it all the time. But one of the things, I had a patient the other day, and I was saying that we only have, so we're on our second hand piece for the Shockwave.
Yeah.
So the Shockwave, each hand piece,
we're almost done.
Each hand piece has 500,000
500,000
shocks on it. And when you replace it, you have to pay for that. And that's why you're not trying to gouge your patients, but it's expensive. And I tell people, it's like, when I explain the laser, I say every time I use the laser, it's every time I drive a car off a lot. But I think every time you use the Softwave, it's like taking your yacht out into the ocean.
Exactly.
Because it's way more expensive to replace the parts, which is true. But we have gotten the return on investment on both.
Man, paid off 3 months both.
Yeah. But when I was saying to the patient, I was like, she was like, oh, what do you do? Like when it gets close to, I was like, when it gets to 3,000 shocks, we just shock each other.
Yeah, whatever hurts, we blast each other.
So I'll be like, you know what, my hip hurts. Because
I always have something.
He runs every day. But last time we did it, like my right hip hurt. So I had him shock me like 1,500. We shocked his knees 1,500. But I think the technology is great. You can use it on yourself for sure. And we tend to wait till it's almost done.
And the funniest story I had was last week. Some lady's getting ready to do her Shockwave. I said, well, the biggest problem is the room's in use. My wife, who's the other doctor's in there, so we got to wait for it to get done. And as soon as you open the door, you walk out. I'm like, that's my wife. Should we go in there? I'm like, and that's my daughter. I'm like, what's going on? She's, what do you mean? I'm like, apparently my daughter's getting it done today. I'm like, ankle? She twisted her ankle. So yeah, the patient's like, what do you mean? I'm like, well, my daughter, she's addicted to the laser. We usually do use the laser she must be.
If it's a real
must be 2 or 3 days in. She looks at me like, yeah, no, we do it ourselves. I get it.
Yeah, like I think it's good. It's like proof of
and
concept.
It's not fake, because here's the truth. Patients don't hate being sold.
No, it's so true. They hate being sold junk.
If what you're offering isn't junk, stop acting like it is.
And I think that's really true.
true. And I think when we first started doing this, I'm like, oh, like I couldn't make eye contact with the patient. I'm like, if you
We
wanna...
didn't know.
But after doing this for a year, I can tell you it is all about proof of concept. Again, your visual analog scale is so important because one, we can all be very impactful together. Like, I just know, like, even in our independent podiatrist network group, we have over 300 doctors. If we're all doing this technology and we could do big studies together. Am I wrong on this?
Totally.
We could do big studies. Obviously, there are going to be some patients that just don't do as well as others. Patient selection is huge. I've learned over the last, we probably could do a whole podcast on just patient selection for Softwave therapy.
I think
patient selection for laser therapy, because that's important. If you're talking to the patient and there's any negativity, do not do it on the patient.
Oh, yeah, that reminds me of probably the best lecture I ever heard. Remember you were there? It was one of those, those PEG lectures we go to where you save money on your malpractice. Somebody did one of those PEG lectures. He went through his whole thing, and he went back and looked at...
They're psychotic, antipsychotic patients.
No, they're going through the list, not the antipsychotics. They're going through the list of allergies. And the patient had 12 or 13 different allergies.
Guys, if you have allergies, I believe in you.
And the guy said, maybe you're just allergic to surgery. And that could have been the most profound. Some people are allergic to whatever you're going to do to them. You need to feel that out.
But I think that these things work. If you're not doing them, look into them. We're not trying to bully you into them.
No.
But if you're not doing them, check it out. Look at the groups. If you're not a part of the Independent Podiatrist Network, join. If you are interested in other things, I do the 3D printing custom orthotics, and I have a group for that. If you're interested, just drop me a little message and I'll send you the link for that. But honestly, if this episode hit home for you, share this with a podiatrist who you know.
And if you're that podiatrist listening right now, great. You showed up. That's step number 1.
Honestly, until next time, this has been Podiatry Unfiltered. I'm Dr. Michele McGowan.
I am Tim Henne, the esteemed guest, and I'm still the favorite guest.
You've been my only guest. So see you next episode.